Hi, my name's Jenna. This is Alex. He has agreed to be my patient in the video. Alright. Hi, my name's Jenna. I'm your student physical therapist assistant today. How are you?
I'm alright. How are you doing today?
I'm good. Alright, so I'm just going to take you back to the gym and then I'll ask you some questions and then we'll get started, okay?
Alright.
So I'm going to walk out and come back in. Alright, so where's your pain at?
My pain's in my shoulder. It kind of goes down to the front of my forearm here. It's pretty consistent all day. It's kind of like an aching pain that radiates from my shoulder down to my forearm.
Okay. Was there anything that kind of set off this injury or anything that happened?
Not really. I've had it for a while.
Okay. So on a scale of 0 to 10, 0 being no pain at all, 10 being the worst pain you've ever experienced in your life, what would you really rate that pain at, while just sitting here right now?
I probably have to go with a 7. It hurts pretty bad.
Okay. All right. Well, we will get started with some stretching, and then we'll go from there and talk about the whole treatment plan, what we're doing, what I'm doing. If at any point any of this stuff really hurts, you need to let me know, okay? Okay?
Alright.
Alright, so we're going to start off with our stretches. So I have a couple stretches just to start out with, just to warm up, to help just relax your muscles, really just, okay, we'll get in there. So the first one that we have is called our levator stretch. So what we're going to do is we're going to grab our head and pull it towards our armpit. So then we're going to do that, and we're going to hold it for 30 seconds. Yep, make sure that your nose is towards your armpit. I'm going to hold that for 30 seconds, and you should feel a stretch down in here for that muscle. So what that will do is just to help warm up your muscles before we start exercising and help them get them loosened up. That'll also help with the posture, getting the strength back, and stuff like that. You hold it for 30 seconds, 5 times each side, but for the sake of the video, we'll only do just a couple reps. And then for our second one is going to be called our upper trapezius stretch. So what we're going to do is we're just going to grab the side of our head, pull it down. You should feel a stretch back in here, but this arm also has to be behind your back to help get that stretch. So you should feel the stretch in the same area, but kind of deeper, so along the shoulder up there as well. And the same thing, we're going to hold it 30 seconds, 5 times on each side. And like I said, that'll help with the increase your posture and stuff like that by loosening these muscles before we start exercising and strengthening. It'll help all in the end. Feeling okay still?
Yeah, it's feeling alright.
Okay. Alright. So then our next one is called our pec stretch. So what we're going to do is we're going to go in a corner, or you can do this in a doorway. So what you're going to do is you're going to stand a couple feet away, put your arms up on the wall, and then you're going to lean into the corner. And you should feel a stretch right in here. And like I said, that'll help loosen up the muscles before we exercise. You don't have to hold them up that high. You just want to be able to feel a stretch right in here. So that'll help stretch out the front and the back of your shoulders. And same thing, we would hold that for 30 seconds, do it 5 times. All right. Do you feel loosened up and ready to try some exercises now?
Yes, ma'am.
Okay. So our first exercise I want to do will really help with your neck muscles. That'll really help, straighten out the back of your neck into your posture. So the first one we're going to do is called chin tucks. It's pretty self-explanatory. All you're going to do is you're going to push your chin back into your neck. So then You don't have to hold it or anything, just kind of just do a few of those. We would do 2 sets of 10, and then for the sake of the video and the time, we'll just do 5, okay?
Yes, ma'am. All right.
Good job. How'd that feel? Okay?
Good.
Pretty
Yep.
good? Awesome. All right, so then our next one that I want to do is I really want to focus on these muscles back here. So on top of your shoulder, the back of your shoulder, around your scapula, and along your neck, okay? So the next one we're going to do is we're going to do some shoulder shrugs. So I really want you to work on that. So that'll help strengthen all of this to help also align the posture, make sure, and then it'll also help with, being able to reach more and stuff like that once we get you strong in the shoulders and the scapula and the neck. That'll also help with all your functional movements. And you only have to do 5 reps. But we would do the same thing for all these exercises. You do 2 sets of 10. And then, so I have our next one I would like to do would be our scapular retractions. So what I want you to do is I really want you to try to pull your shoulder blades together and squeeze them together like there's a pencil in here. And that's really what I want you to focus on. I really want you to focus on strengthening these muscles back here. That will also help with the posture. Building up the strength will help align everything a lot better. Good. Good job. All right, you ready for the next one?
Yes, ma'am.
All right, so these are we call them TIYs. So this helps with functional movements of your flexion and, going out to the side and up. So it will help with, being able to reach into the cabinets.
All right.
So it's called TIYs. So what we do is we're going to take our hands and we kind of go up as far as you can without pain. I don't want you to do it through pain. So whatever you can do is fine. So we're just going to go up, and we'll do that 5 times out at about like a 45-degree angle. 5 times. This simulates our Y. And then out to the side with our thumbs up. Make sure your thumbs up. Same thing. 5 times. Okay?
All right.
You can step out towards the wall. Is that feeling okay?
Mm-hmm.
Okay. Good. Do 2 more times each.
Okay.
Okay. And this one would be more at like an angle right here rather than out here, okay?
All right.
So it'd be right here and then out there, okay?
Okay.
There you go. Perfect. Good.
All right.
All right, so I just have a couple more exercises left, and then I really want to get hands-on with you, so I'll kind of explain that later when we do that. But first of all, this is also going to help, with more of that range of motion since you don't have it all the way. These are called wall slides, so this is help assisting your range of motion, which we call active assisted range of motion, which instead of just you doing it by yourself, you also have the wall to support you. So what we're going to work on is we're just going to slide our hand up the wall, kind of lean into it. You'll kind of feel a stretch in your armpit. Don't go past any point of pain, so if you start to feel any pain, you can stop there. This is just to help try to get that motion back. Make sure you kind of lean into it a little bit. And you don't have to hold it or anything. We're just going to go up and down with it. And we're going to lean into it, really making sure we get that stretch so we can really get more of our motion back. All right. So the next one is we call them our wall angels. So we're gonna go up against the wall. We're gonna make sure our back is flat, our shoulders are flat against the wall. What I want you to do is I want you to look straight ahead, thumbs up. What I want you to do is kind of simulate like you're like a wall angel. So like a snow angel, like you're making. And like I said, if there's any pain, I just want you to go up until you have no pain. But make sure you're keeping your back and your shoulders flat against the wall without lifting off, because this will also help increase that posture. And that's really what we want to work on, since you have kind of a deviated one.
All right.
Good. All right, so then our last one is our wall push-ups. So we're gonna stand a couple feet away, and we're just gonna, like we're doing a push-up on the ground, but it's gonna be against the wall.
All right.
This will also help strengthen our shoulders, so we can also, that will assist in helping getting our range of motion back. How do you feel?
Pretty good.
Okay, so we're gonna come over here to the table, and I'm just gonna do some more hands-on stuff with you. I don't know where to lay this. All right, so these are called our mobilizations. So in terms, this is just supposed to help get that motion back. So this will help to increase your range of motion. Depending on what mobilization I do, the first one I'm going to do is we're just going to do shoulder ones. So I'm going to do an inferior glide, which I know you don't really know what that means right now. But I just want you to relax your shoulder all the way. I want you to just let me have it in your arm. And what I'm going to do is I'm going to hold it at about like a 30 to 45 degree angle. And what I'm going to do is I'm going to find that joint space that you have. And I'm just going to push down until I feel you kind of tense up, okay? So this will help you get more of that abduction back, okay? So let me find your joint space. And then what I'm going to do is I'm just going to push down until I start to feel you kind of tense up. And then I'm just going to hold that for 20, 30 seconds, depending on how long you need it, sometimes a minute. And then we'll do that a few times. All while you're just staying relaxed. Okay, and then I'll do a posterior glide, or a posterior mob as well. So what I'm going to do is I'm just going to push down on your joint space and pull up with this arm, okay? If it starts to hurt, just let me know, okay?
Mhm.
So joint space, just push down and pull up with this one until I start to feel you tense up. And then just hold that. And then back down. And we'll just do this a couple times. Okay? So make sure you're just staying relaxed. Okay, one more time. Alright, so then I want to move on to the scapula that you're having problems with. So I'd actually rather you lay on your stomach. And then all I'm going to do is I'm just going to move your shoulder around. So I'm just going to move it side to side. I don't know what's more comfortable for you. If you want to put it above your head, you can if that's more comfortable. And then all I'm going to do is I'm just going to move your shoulder blade side to side. So more like a medial lateral. And hold it. And do that a couple times on each side. And And then I'm going to do a superior and inferior glide where I'm just going to be pushing it up and down, okay?
Okay.
Okay. Same thing. I'm just going to do it a few times, holding it for a little bit. Alright, and then you can sit up. And lastly, what we do for our treatment is you have a continuous ultrasound on you. So what that means is the parameters that would be set, you want deep heat to facilitate motion. So you would have it on 1 megahertz. The parameters would be set at 1.0 to 2.0 watts per centimeter cubed. And since it's a continuous ultrasound, it would be, the duty cycle would be 100%, so it would just be constantly going. And you just put the gel on the sound head and you just move in small, slow circles. And some contraindications of that would be cancer, TB, a person that's going through radiation therapy, abscesses. You should never do it on a pregnant woman on her low abdomen or her abdomen or her low back, or over growth plates in children. And then some precautions that you should look for are open wounds, I don't know anymore. Oh, if you get discomfort, if the patient starts to feel a little bit of discomfort, you could add more gel, decrease the intensity, or move the sound head. And yeah. So that is all I have for you. How's your pain now? Is it still about the same, or did you say that it would be better, worse?
I think it's a little better, actually. It's probably a 4 or 5 now.
Good, that's awesome. So with that ultrasound that we did on you, you could experience some redness. That's totally normal. That's just because there's heat going into it. That should subside by the end of today. But I don't have anything else for you. That's totally normal. Just keep watching for that. If it blanches out, I would let somebody know. If you need to take any pain medications or whatever you take to relieve your pain, you can also do that. Is there anything you have for me? Or?
Nope, I think that'll be it.
Alrighty. Well, I'll see you next time. Next time we will start implementing for more take-home stuff that you can do, so a home exercise program. So like those stretches, I can print out some for you, and we can give those for you to do. Since we did that ultrasound, it's really to help facilitate more motion. So I wouldn't do any like stretching or strengthening exercises for about 15 minutes if you wanted to try any at home, but I can give you some for home, and we can keep working on that so we can really increase your strength and your posture and your range of motion when we do that. So next time you come in, you're scheduled 3 times a week for the next 2 weeks, and then we'll see where it goes from there. If you have any comments, questions, concerns, you can always call in the office and you can just ask. And yeah, if you need anything.
Awesome. Thank you very much.
All right, you're welcome. Have a good rest of your day.
You too.